the stereotype is that African Americans don't go see mental health providers, which
Right.
is never totally true. But I think what happens is sometimes people make joke of going to see a mental health provider. Like I said, you're crazy, you go see your psych doctor. So it's said in a way that's kind of disrespectful and doesn't really honor the profession, nor does it honor that person's desire and emotions and need that they want to do that. So people start to internalize that. So when they really, and they make a joke about it. So when they really think they need to go, it's kind of like they're caught in the middle now. They have kind of incongruency in their brains. Like, I know I want to go, but I don't want to be the joke.
Right.
So who would I follow? Do I follow my mind and body that's telling me you need to go? Or do I follow the stereotype is, well, I'm gonna be a joke if I go, so I don't want to be the joke, so I won't go. So until they wrestle with that kind of incongruency, they're just kind of stuck in the middle there on seeking help. Right. But again, that's one way where just kind of educating somebody on what it is to go see somebody and why you're going is going to be important. Because most times, when I was seeing people, probably the first session or so after I did my initial evaluation, I would just talk to them and ask, what's your thoughts about coming here? Why did you come? Were you forced to come? What's your impression about mental health care? And what do you think about it? Because I'm trying to understand what their preconceptions were about it. And most people say, oh, I thought I was going to be laying on the couch and you were going to be writing stuff down. I said, well, that is one technique, but I don't use that technique. So I would clarify like what that technique was and when you would use that. And that's something that I don't do, but that was a conversation there because most people's perceptions of therapists and mental health really probably comes from a TV show, a movie, and what they're showing
and a little outdated too. Some of the
and can be outdated, and what they're showing on there usually is some kind of juicy, unethical scenario that's going on that's good for ratings, but it does nothing for regular society. It says I may want to go see somebody, and it doesn't help the profession either. It's creating a barrier by doing that.